All right, so how to characterize non-conscious behaviors? That's the topic for this part of the lecture. So phenomenally, in blind side, things are invisible, but behaviorally, their blind side patients and monkeys' performance indicate that there is a significant processing going on in the brain, and they are using this visual information for their behavior. And according to the Haynes demonstration, normally if phenomenology is that I don't see things, then the performance related to that thing, for example, grading or word, we just can't use it for the performance. So usually phenomenology and performance go together, and that's the Haynes finding. However, blind side, there is a significant difference between these two. So the question now is that can we characterize phenomenology without not by a performance per se? So the idea here is a metacognitive accuracy. The intuition behind this approach is that if we are conscious of a stimulus, then we should be able to guide our behavior flexibly by monitoring the degree of the visibility of the stimulus. Okay, so if you know, or if you are conscious of something, you know that, and you can use that for your behavior. So the metacognition is a concept in the psychology and philosophy, and it is defined as an awareness and understanding of one's own thought process. But here we are going to use this metacognition idea to distinguish between conscious versus non-conscious processing, as it says here. So the hypothesis here is that blind side patients should not be able to take advantage of high accuracy in terms of performance in a betting situation. So they can't utilize the information that guides the behavior as long as they are claiming that it is not phenomenally experienced. Okay, and a betting here is a much more flexible type of behavior rather than moving around or making an eye gaze and so on. So it's more cognitively demanding, and there should be some kind of discordance disconnect between non-conscious processing to the flexible behavior like betting. And in particular, what we are going to look at is a post-decision wagering paradigm. After saying I saw it or I didn't see it, then we ask the patient to bet the money. And then if the patient is correct about the decision, and if they were betting higher money, then they can get double the amount of the betted money. Okay, so if patient has this incentive to maximize their money account or reward account, in the case of the baby or animals, this kind of idea can be actually utilized in fact. So if there is a motivation for these participants to maximize the reward, then utilizing any hint of your own behavior performance should be utilized for the wagering of betting. That's the hypothesis. Okay, and in the blind side patient case, GY, this paper in Engineering Science tested this explicitly. Here they actually tested many bunch of different kind of situation, but in particular, important thing is that three conditions: 0.2 super threshold for the visual hemifield, and sub-threshold for the blind field. So this one, 0.2, is the one GUI cannot say that I saw it, but can always localize it accurately. Okay, and then 90.96 is the super threshold for the blind threshold, blind field. So GY, remember, he is on a relative blind side. So if the contrast is really high enough, then it looks almost like a super threshold visual stimuli. And in fact, the results of the betting behavior for the 0.2 super threshold and the 0.96 for the super threshold of the blind field is exactly the same. But the point is, what happens in the 0.2 sub threshold for the visible blind field? So this is a first summary of their result. first, the x-axis is the performance of this localization or some kind of forced choice task, okay? And then the performance performance is 0.5, 50%. And then both in supra-threshold situation or sub-threshold situation, the accuracy is around 70 to 85%. So this task is moderately difficult and not really perfect, but it's definitely above chance, 50%. And then the important thing is this wagering, okay? Wagering of the percent advantages, meaning that here they preliminarily define that the percent advantageous betting as high wager, doubling, betting $2 or £2, depending on where you are, upon correct performance, okay? If you are correct and then you bet the $2, it comes back as $4. And if you are if you are mistaken, then your $2 gets lost. On the other hand, if you are making a mistake, then you still need to bet, and you can bet lower amount, which is $1 or £1. And then if you are correct, then you can get double the money, $2. But if you are incorrect, then you lose $1. So the advantageous betting is that $2 upon correct and $1 upon incorrect. And if you analyze it that way, this supra-threshold case, blindsided patient was actually highly advantageous, corresponding to the hypothesis that he is trying to maximize the money reward. On the other hand, if in the case of the sub-threshold, he is below 50% in terms of the percent advantageous betting. And this mainly comes from the fact that, despite the fact that he is actually correct, he tends to bet low. And that's the one that goes into, below 50% advantageous, wagering. But if you are astute, then you might find that, so this is first summary of this result. Despite the good behavior performance, x-axis, GY did not bet advantageously when he was correct. And that was, this part, white part. However, there is a possibility of the criterion shift, meaning that, when GY is tested on the blind field, he just don't feel confident in any case. And if that is the case, he would just, bet low, 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 low all the time. So that corresponds to the sort of signal detection paradigm of saying, no, 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 I didn't see it at all, or yes, yes, I saw everything. That's a sort of the opposite end of the ROC curve. It doesn't give us any kind of, clue about the discriminability. It's just ambiguous at the, starting and the ending. So that's what we are going to take a look with the improved version of the metacognitive accuracy method. So to rule out the criterion shift account of the what we are going to introduce is this so-called type 2 signal detection analysis. Okay, this is not only useful for the consciousness research, but also in other types of the psychological research. So you might want to understand this. So usually, in type 1 ROC analysis, there is an observation interval, either signal or noise present, and then people or machine or anything can make a decision about whether signal was present or noise was present, or signal was present or absent. And in the case of a type 2 analysis, what instead of this observation and decision kind of dichotomy, what we do is to lump together this one set of the response, signal and the response as one thing, and then consider it as correct or incorrect trial, and then followed by the confidence interval, a confidence rating judgment. And that could be, in the case of the wagering, it's either high or low wager. And then this is the discrimination of the correct or incorrect on your own. So it's an accuracy of the monitoring of your process, okay? And how it works is as follows. First, you define hit and the correct rejection as correct, because both of them are correct. according to this, framework. And then define false alarm and miss as incorrect. And then define the confidence or wagering response as yes if it's high and no if it's low. Then interpret the task as can we detect the correct response in ourselves by high or low judgment. Just to give you again idea, in the type 1 analysis, we had this stimulus and then response matrix, and then yes or no, present or absent, yes or no, and we called this one as hit, and then this one as correct rejection. Okay, hit and correct rejection, and then these becomes now the correct to incorrect axis of correct here and then incorrect here. So these two becomes here, and then false alarm and the miss here, response yes for stimulus no, and stimulus yes and the response no, miss, both comes into here of the incorrect trial. And then now define the confidence or wagering of high or low. So this is a second order matrix here, and then correct trial followed by the high wager as second order hit, and incorrect trial followed by low wager as correct rejection. Okay, and then false alarm and miss. So basically, by relabeling all the information that is available in the standard experiment, as long as we have a confidence rating or wagering, we can do this type 2 analysis. Okay, this is a bit complicated, but that's the idea of the type 2 signal detection analysis. Okay, so here's the response or results of the GY's performance in this task. In the subthreshold situation, so he says he can't see it, and in the right hemifield, blind side hemifield. First thing you notice is that among 200 trials, you see that the correct trials dominates. He can discriminate between A or B, in some sense, okay? And he make a mistake roughly 30% of the time. So it's a 70% correct and 30% incorrect. On the other hand, he gives a high wager and low wager in the correct trials. High wager should be much, much higher than low wager in this case, if he knows he is correct. But it doesn't appear to be that. And also, in the case of incorrect, he should wager low, and no, he should never wager high if he knows what he's doing. And it's a bit higher here, but see that, if there is an overall bias towards a low wager here, then it may be the results of this, a bias in the response. So we can't exclude this possibility of the criterion shift. So what we do? Now the type 2 analysis. We first recategorize this, correct and incorrect trial as if stimulus present and stimulus absent trials. The table contents doesn't change. And then the high wager is now present response, and the low wager is absent response. And then I saw it and I didn't basically refers to I know I was correct. I don't know whether I was correct. Okay. And then if you do that, then this becomes a hit, this becomes correct rejection, and this becomes false alarm, this becomes miss. And then you do the same kind of analysis as before. And then that's hit, miss, false alarm, correct rejection. And then type 2 hit rate becomes now among 141 present trial or incorrect trial, he gave a high wager 67, which is 0.48. Okay, that's a hit rate, type 2 hit rate. And false alarm rate is among 59 stimulus absent or incorrect trials, he gave high wager in 23 trials, and that's 0.39. So this ratio of hit rate versus false alarm rate is what our ROC analysis deals with. So this is now you should be familiar with this ROC curve, percent of false positive, or it's called also sometimes 1 minus specificity, and percent of the true positive, or hit rate or sensitivity. So this sensitivity and 1 minus specificity is something that is also utilized in psychology or other types of the population effect, and yeah, so other field as well. Okay, anyway, so the type 2 hit rate and type 2 false alarm rate, if you plot it here, then that rockets here, 48%, and also roughly like 38%. Maybe it's more, a little bit more to the left, somewhere around here, maybe. And then that corresponds to the sort of type 2 ROC curve. If you do it, across many different, experiment, and then change it, and then that roughly corresponds to D prime equals 0, or area under the curve for type 2 AUC to be 0.5, whereas that type 1 AUC is here, meaning like D prime of maybe 1.5 or something like that, and then AUC is also area under the curve is 0.7 also. So that discordance between type 1 and type 2 is, possible to calculate here. And then if there is a significant discordance like this, we can conclude that, oh, so this is qualitatively, and not only qualitatively, but quantitatively, we can show that dissociation of conscious versus non-conscious using the metacognitive accuracy. So in summary, in this part of the video, I explained the phenomenal and the behavioral dissociations in the blind-side patient and the monkey can be described as loss of phenomenal vision by trusting their report, and also other types of the task performance, and then still residual behavioral performance, in particular the eye and also eye movements. However, this information that guides this residual behavior is inaccessible for the metacognitive accuracy. And when it can be established, then we can say that this is like a blind-side behavior, strong behavior without phenomenal vision, and its information is inaccessible. Okay, so that's the way to distinguish conscious versus non-conscious processing. And then the last part of the video this week is going to talk about visual systems to explain blind sight.